welcome to A World Without Malaria. In today's chapter, we'll explore tuberculosis, referred to as TB, and we'll think about its connection with malaria. Now, to understand the significance of TB, consider this. In 2021, during the COVID-19 pandemic, 1.6 million people lost their lives to TB. After COVID, TB was the second leading infectious killer that year. And what's more than 10.5 million people caught tuberculosis during that same time. Now, why should we be concerned about these horrible statistics? One of the answers lies in our values of compassion, of love, and of caring for those in need. Much like malaria, TB's effects are devastating, especially when it strikes individuals in already vulnerable communities. Those suffering from TB are more vulnerable to malaria, and it creates a compounding health crisis. The good news is that, like malaria, TB is both preventable and curable. Follow along and take notes in Chapter 15 of your manual. Enjoy.
Hi, my name is Florence, and I'm going to talk to you about tuberculosis. Is it familiar? Maybe yes, maybe not. Pay good attention. Tuberculosis is a serious disease that has been around for thousands of years. It is usually abbreviated as TB. In the lungs, it is known as pulmonary tuberculosis, or sometimes it's called consumption, but it does affect other parts of the body as well. All age groups are at risk, so it is a serious health problem that we need to deal with. About 1/3 of the world's population has been infected with TB at some stage, but only a small percentage of these suffer from disease. Over 95% of TB deaths occur in low and middle income communities. What a pity. Young adults and children are most frequently affected. Therefore, TB is a major burden to future development in these vulnerable communities. TB infection is spread from person to person through the air. When people with active TB cough, sneeze, or spit, droplets containing TB bacteria are expelled into the air. These droplets are breathed in by other people. A person only needs to inhale a few bacteria to become infected. However, TB can also be transmitted through consuming milk from cows infected with TB bacteria. That's why it is important to only drink milk that has been heat-treated, such as in pasteurized milk, as this eliminates the TB bacteria. Okay, let's now look at the signs and symptoms of TB. It is often 6 to 8 weeks before the effects of the TB bacteria in the body are noticed. TB can affect almost any part of the body. It is most commonly found in the lungs, but can also go into the brain, intestines, liver, spleen, kidney, bladder, urinary tracts, uterus, and bones. If the TB bacteria is found in a number of different places, it is called miliary TB. TB often begins as a small area of infection in the lung and spreads slowly. The organisms may then spread to lymph nodes and other parts of the body. The signs and symptoms to look for are, firstly, a cough that has lasted more than a month. This is often worse just after waking up and is accompanied by thick phlegm, which may look cloudy and in the later stage blood-stained. The patient may have a mild fever in the afternoon and sweaty at night. They will also have a loss of appetite, weight loss, and an increasing weakness and tiredness. The patient's voice may get hoarse. Sometimes people with TB will develop skin lesions, which are sore areas that are difficult to heal, and if they do heal, they often break open again later. Tubercle nodes can also develop, and these are tumors full of TB bacteria, often involving a lymph gland. TB is confirmed by a TB skin test, TST, and the TB test is also called mental tuberculin test. The test is done by putting a small amount of TB protein under the skin. The skin is reviewed 48 to 72 hours later, and if there is a reaction such as a small red bump, it indicates a positive result. Tuberculin skin tests will be positive in all people who have been vaccinated and in people who have been infected, whether they are sick or not, as is the case in latent TB, and we will discuss latent and active TB later. Now, a positive test result is not proof of active disease, but can be helpful in the diagnosis of TB in young children who have not been vaccinated. Now, some people are more at risk of getting TB than others. Tuberculosis is a major problem for the poor, especially for those living in slum and squatter areas. In many places, whole families sleep in one room and young children become infected when older people with active TB cough openly during the night. These may be parents, grandparents, uncles, aunts, or friends, and they are often not aware that they have TB. People are more at risk if they are malnourished. People are also more at risk if they have health problems such as diabetes, chronic lung disease, and a low immune system caused by HIV/AIDS or chemotherapy. Alcoholics and smokers are also more at risk. Okay, now let's look at the two types of TB, latent and active. Latent TB occurs in people who are attacked by the TB bacteria, and if they have good health, the immune system will fight the disease, preventing it from spreading through the body. The person is not sick and has no symptoms, so is not infectious. However, if they later become ill with another sickness, or if they are malnourished or have a low immunity, the dormant TB germs can revive and lead to active tuberculosis. It is not necessary to isolate these people as they are not infectious. However, medication is used for 3 to 6 months to prevent TB occurring at a later stage. A healthy diet containing all essential nutrients is important for these people in order to help them stay well. Active TB is a much more serious health problem. People with active TB are symptomatic and have a confirmed diagnosis. This diagnosis is done by a microscope with 3 separate sputum specimens. TB, as we know, spreads as droplets in the air, so all close contacts of the person with TB need to be tested in case they also have TB. Chest X-rays are not essential for diagnosis, but are used to see the extent of lung damage and also to follow the progress of the disease. Okay, now let's look at how to manage the active TB. People with active TB need to be isolated in a well-ventilated room and commence the appropriate antibiotics. These antibiotics will need to be given for at least 6 months to a year. In many cases, the TB bacteria have developed a resistance to the antibiotics, so in order to treat the person properly, they will often need a mix of 2 to 3 types of antibiotics, which will need to be taken sometimes for as long as 2 years. To take these medications over such a long time is difficult because, as well as the time element, they are often expensive and have unpleasant side effects. Because of this, The medication in many countries is given to the patient by the doctor or nurse, and they are watched while swallowing the tablets. It is called DOT, directly observed therapy. We know that TB is a serious and potentially fatal disease, so it is important to look at preventing people from getting TB. And it is also important to prevent infected droplets from being released into the air, so it is vital that people cover their mouth and nose when sneezing or coughing, and of course, stop any spitting. It is important for all vulnerable children to be immunized with a BCG vaccine to help prevent tuberculosis, and this is often done in the first few days of life. Having a healthy diet with food from all the essential food groups will help people to have a good immune system and be able to fight off the TB bacteria. Early diagnosis is important in order for quick treatment and prevention of people catching the disease to take place. When treating someone in the early stages of the disease, it is important to wear correct protective clothing such as face masks and gloves, and to isolate them from other people. Once antibiotics have been established, protective clothing will not be necessary as they are no longer infectious. It is important for communities to look at public health issues such as poor housing and overcrowding, as it is in these situations where TB thrives. Now, people with TB often live in areas of the world where there is also a high incidence of malaria and HIV/AIDS. Each of these diseases threatens life. How much more so when a patient is exposed to all three? Remember, TB is preventable, TB is treatable, and TB is curable. Until next time, bye for now.